After the child who lost his life in Kenyatta Referral Hospital here in Nairobi due to a fork Jembe logged in his skull, Kenya Medical Practitioners, Pharmacists and Dentist Union Kmpdu has now questioned the referral hospital emergency care in the country for not having enough doctors to handle a case like this.
Family and friends of the young boy who lost his life at the Kenyatta National Hospital on Tuesday, 11th October 2022, after having a foreign object, a fork Jembe, lodged in his skull for almost 2 days. This kind of deaths are a reminder for every Kenyan that none of us is safe until the public healthcare system in Kenya guarantees the highest attainable standards of emergency care to the humbles amongst us.
According to the union, the child who was brought to Kenyatta on October 11th after staying with a Jembe on his head for 2 days, to Kmpdu, this was not according to the principles of emergency care.
The painful death of this boy, as his mother watched, is yet again a reminder of some of the previous deaths which have caused uproar in the country that Kenyans probably seem to have forgotten. On Monday, 7th December 2020, a vibrant 28-year-old Dr. Stephen Mogosu died under similar circumstances, having contracted COVID-19 from the ward he was working. A nascent medical career nipped in the bud. Furthermore, his salary was unpaid for the period up to the point of his demise. Many other preventable deaths have occurred in our health facilities, and mainly as a result of weakness in our healthcare system. For instance, lack of ICU facilities, absence of appropriate health products such as oxygen or blood, and also lack of the right mix of skilled personnel.
According to the Kenyatta Hospital, through a press release, medical tests including CT scan and blood tests were conducted to confirm that the fork Jembe caused an injury to the child's brain.
While the facts surrounding the death of this innocent young boy remain scanty and far between, there seemed to be a pattern. He got injured in their home in Kmpdu County, was taken to a small dispensary where the right call was made to refer him to Thika Level 5 Hospital. Kmpdu has indeed taken time to audit service competency profile prescribed by the government of Kenya, and has concluded that for Thika Level 5 Hospital to be considered so, it needs to have at least a neurosurgeon, anesthesiologist, and many other consultants, and indeed an intensive care unit capabilities. These as per the staffing norms of this country. The question Kenyans ought to be asking is why Thika Level 5 Hospital and the management of the Kmpdu County government and the leadership of His Excellency Kimani Wamatangi could not attend to this boy at the time he was presented at the hospital.
The union now want answers from the Thika Level 5 Hospital in Kmpdu County following the death of the child.
The tenets of devolution as the principle of governance and resource distribution is to ensure that services are redistributed fairly and accessible to the people, as was the hope of every Kenyan at the promulgation of the Constitution 2010. Indeed, governors across the country have made it their message to keep reminding Kenyans that part of their role is to oversee the delivery of health services in the public-based facilities. Why then, as the governor of Kmpdu County, His Excellency Kimani Wamatangi failed to tell Kenyans and the people of Kmpdu County, where the deceased child resides, why he dropped the ball at this instant case? Is it logical that more than 10 years after the devolution of health services, Kenyans are still forced to seek for the health care services in Kenyatta National Hospital, when the counties have been empowered by the national government and the Constitution to provide and deliver the highest attainable standard of emergency care to all Kenyans?
The union now wants the health sector be managed by the central government from the devolved government in the country.
It is time we embark on deep and honest conversation about the public healthcare sector in Kenya. How many Kenyans in this country are going to lose their lives before we come to the reality of dysfunctional public health care. That the delivery of health services as a public utility and can only be equitable if it is taken up by the states. Healthcare is expensive and can only be effectively funded by our taxes that we collectively make available to the state to manage accordingly. Kmpdu therefore makes a clear call to the national government and the county government of the day to refocus their attention and seriously embark on making healthcare a social good.